Dimple creation is a common surgical procedure which we are doing it very regularly today. Just people want always have a good smile with a pretty dimple on their cheeks. So this procedure is an elective cosmetic procedure and can be done totally safe under local anesthesia. And if we want to create a dimple, the dimple can be created as per the patient's wish in terms of size, shape, position, and usually the dimple is placed anatomically 1 inch away from the angle of the mouth on both the sides. And some people will have a dimple, but it will not be very prominent when they smile. Even in such cases, we can make the non-prominent dimple, which is existent already, can be made into a prominent dimple when they smile it. So this procedure can take around 45 minutes, can be done under local anesthesia, and it will be totally scarless because the surgery and the procedure will be done totally from the inside of the mouth. So how is it undertaken? In the area where the dimple is created, initially we have to mark that area. So this procedure is an elective cosmetic procedure and can be done totally safe under local anesthesia. Then we have to give a local anesthesia into that area so that the total area will become numb and painless, so that the procedure can be safely undertaken under local anesthesia. So through the inside of the mouth, a part of the buccal mucosa can be removed. And Buccinator muscle, which is present just below the mucosa, can be split or removed little bit and go to the skin depth. So the skin which is present in that area or dermis can be sutured to the muscle, minimum 2 to 3 stitches depending upon the size we will create, and the dimple can be made. So what are the post-operative care and the consequences of dimple creation? Initially there will be mild pain, hardness, redness will be there in that area where the dimple is created. So 2 to 3 weeks this all symptoms will come down, and there will be one precaution which you need to immediately take care after the surgery, because see, once the dimple is created there will be an empty space. So always try to do this movement where the dimple is created so that any collection inside will come out and the empty space keeps collapsing and the wound will heal normally. So initially when the dimple is created, it is static irrespective of the expression. That means whether you smile or not, the dimple will be visible. So over a period of around 2 to 3 months, then the dimple will be visible only when you smile it. So dimple surgery can be done totally safely, electively in a half-an-hour procedure. You can immediately come on the day where you want to get the surgery and then go back after 45 minutes to half an hour after the surgery. So how many times you have to come for the follow-up is the question. So you can come after 1 week of the dimple surgery. Suppose if you are seeing any pus coming out through the area, if you are feeling any pain or swelling in that area, please immediately address us. Or if you feel that the dimple is not prominently seen as it is seen immediately after the surgery, so please immediately come to us. If at all any problem or collection, we will let go of it immediately so that the further problems can be avoided.